Thank you for having us. So I think this follows very nicely from Gemma's presentation, and to give a patient perspective on some of this, on some of the messaging around switching and the challenges that we face. And what I'm going to do is talk a bit about charity, a bit about what we do know at the moment, at least from a Welsh point of view, and then spend the second half focusing on a specific project we are doing, which we've been commissioned to do actually from NHS England, which we're hoping to use the collateral and resources here in Wales, and indeed in Scotland, Northern Ireland as well. So hopefully that will be useful. So I mean, this is a very educated audience anyway, so but just to recap on some of this stuff, that obviously we are talking about 1 in 5 people living with lung conditions. Everyone knows someone with a lung condition of some description, but it's important to remember that every year across the UK 115,000 people die as a result of a lung disease, and asthma alone, 4 people every day die of an asthma attack across the UK. So these are big areas, and lung disease costs about £500 million to the NHS in Wales every year, making it by far the 4th most costly disease area. And this is a condition which I suppose, thinking back to the nitrogen oxide presentation earlier on, that people think of the inhalers as being cheap because per inhaler they relatively are, but actually when they stack up with the sheer number of people living with lung conditions and the sheer number that are taken year after year after year, they get very expensive, and that's why we get into these big numbers, and there's certainly big potential for us to tackle some of those big numbers by better prescribing. And in the international context, as I said, chronic respiratory disease is one of the 4 leading non-communicable diseases alongside cardiovascular disease, cancer, and diabetes. And COVID at first gave us a sort of greater focus. I think gave the NHS a greater focus on respiratory diseases, on lungs in particular. And I think in Wales in particular, we were fortunate to have so many of our respiratory clinicians taking a role in developing pathways and services for secondary care COVID, and then after that long COVID. But as time's gone on, and we've seen long COVID be quite distinct from other lung conditions, I think many other respiratory conditions feel they have been left behind. And our role as a patient-focused service user charity is to relay the perspectives of people living with different lung diseases, and share that in all 4 parts of the UK. And one of the things that comes out time and time again in our surveys is this idea of lung disease being a hidden disability, and actually lack of sympathy, but lack of understanding around the challenge of not being able to breathe. And particularly on days like this, we all find we're all hot and all a bit and all quite bothered because of it. But actually, getting the outside world to understand the real challenges that people with lung conditions have in hot weather, for example, is a major challenge, and trying to share those patient voices is so important to us. So in terms of some numbers, across Wales, about 314,000 people have asthma, including 59,000 children. 74,000 people are diagnosed with COPD. We have no doubt there are probably more people out there with asthma, and definitely more people with COPD out there. But these are the registered, because the ones we are aware of. But then you get into rarer lung conditions, so idiopathic pulmonary fibrosis. 2,000 people there, not really using inhaled medications, more using antibiotic, injectable, and infusion-based medications. Bronchiectasis is a sort of middle of the road condition in terms of prevalence, with 1 in 1,000 people living with it. Some inhalers used, but predominantly antibiotics. And sleep apnea is one of the biggest lung conditions out there, but one that we don't really see enough of to our helplines, but it takes a lot of time and effort from respiratory clinicians, mainly focused around people with weight issues, but also underlying conditions like diabetes, where people literally stopping breathing. And of course, long COVID, which at one point we were saying 10% of people with COVID had the condition. That's no longer the case, but it's still a significant number of people. But what we're going to focus on right now is asthma. So every year we conduct an annual asthma survey across the UK, including here in Wales. We've done it 9 times now, and not this year, but last year we asked specific questions around switching in our 2020 survey, which we published in April 2021. Just wanted to share that learning right now. So we asked specifically, if you were offered the choice, would you consider switching to a dry powder inhaler for environmental reasons? And this showed statistically that actually, yes, the majority were supportive, by a massive majority, in fact. Wales was the least supportive, with 54% of people considering being willing to consider moving to a dry powder inhaler, against 24% saying no, a reasonable number of don't knows. But if we exclude the don't knows, we're looking at 69% of people supporting the idea of moving from MDIs to DPIs. So significant numbers of people. We sadly didn't ask this question in our COPD survey last year. We can't compare it on a quantitative method. But what we do know from our qualitative conversations, through collecting evidence for our helplines and running patient sessions, is there is less support for this agenda in the COPD category. People are not necessarily massively hostile to it, but they are more reticent. They are less worried about the environment. They're more the nature of the condition, the nature of the demographic living with the condition, and I'll come back to this later on, means a lot of the environmental messages don't necessarily resonate with them, and they are just scared about being breathless and need appropriate medication. So we have more of an uphill battle with COPD, but in asthma there is clear support, and we've seen this again through our quality work over a number of years, now backed up by our patient survey of more than 8,000 people across the UK. So what do we do with this, and how do we actually use this in a user way to actually make sure we can alleviate these concerns and actually help people with the transition to lower carbon inhalers? So I said before, we've been commissioned to do some work with NHS England on this, which I'm keen to share with you. So our hope is that by the end of the year we'll have a range of assets we can use here in Wales as well. So this project, which we signed up to in the sort of late spring, we signed contracts on it, is aimed to explain to people that by managing their lung condition well as changing inhalers, people with asthma and COPD can support the NHS net zero commitment in a way that's also better for them. And they were keen to come to us to find out how we reached people who are harder to reach, particularly in the COPD community, but also people from disadvantaged communities and minority ethnic communities as well. So we've done some initial work on this, which we started to share the feedback. This will inform the assets and messaging that we are developing. So our aim for this project ultimately was to achieve was to ensure that there was better health for people with inhalers, and crucially we could get lower environmental impact from inhaler usage. And apologies, some of this is a bit small on the screen, depending on what sort of device you've got. So the changes crucially wanted to facilitate was obviously increasing awareness of the benefits of environmentally of certain inhalers, creating switches, and challenging people to actually to improve their technique, change their devices, disposing of inhalers properly, which I'll come back to, and linking into our sort of general asthma campaigns and COPD campaigns, making sure that people were getting regular reviews of their condition, which included an inhaler technique. So we identified that there were 3 key audiences we wanted to break this down into, and this was a methodology that we took. So we looked at the disadvantaged stroke disengaged audience, the engaged, and then the environmentalists. So if we look at first on the left, the disadvantaged and disengaged. So these are people who, and this is bear in mind it's an English setting, you might not have English as a second language. There was a degree of digital exclusion, possibly because of age or lifestyle or background. The cost of living was far more pertinent to them than the rest of the population. They tend to be older as well, and actually they don't actually understand or realise how to improve their care. That's the first one. The second one is a more engaged audience. So the sort of people I would argue who actually would be more likely to be using the asthma and COPD apps in a Welsh context. So really motivated to manage their lung health, likely to be engaging with us as a charity on social media, but anxious about changing inhalers because they like the inhaler they're using, they think it's working for them, and a bit risk averse. And then finally, you've got the environmentalists, and this is particularly in the younger asthma cohorts. So they're very passionate about this agenda. They're the ones who definitely would have been clicking in that 70%, and with the sorts of people who ring us up all the time and complain about disposal of inhalers not going far enough, and recycling being the main challenge. So quite a different age cohort, different cohort. And as part of this, we're considering whether it's asthma or COPD, or it's looking at age and looking at what support people need as well. So what we learned, so in terms of building this project, we started looking at the user insight. We started this with some sort of testing some messages on Facebook and Twitter. So actually trying to engage people with videos and talking about basically about good inhaler technique and good medicine management, and seeing what responses we got back, and starting the conversation in terms of good asthma and COPD care being green care crucially, but starting with technique. And we commissioned Britain Thinks, a polling organisation that we used a few times over the years, who are very good at actually at pulling together harder to reach communities, particularly in ethnic minority communities. They're very good at doing very good qualitative research. So this project, they took 33 interviews across a range of different people and different pride communities across England to try and actually find out what their motivations were and how they would respond to messages around this. And some of this was done actually in community languages as well, where English really was a barrier. And what we learned from these discussions is that most people didn't know what type of inhaler they had. They were limited very much to colours and to brand names, and I'll come back to the brand name issue later on. They had very low expectations of their quality of care. So the sorts of so the 5 fundamentals of COPD we talk about, or the three RCP, major basic criteria of good asthma care, they were largely oblivious of it, and actually were in many cases suffering in silence. We found there were real challenges trying to find people with COPD in South Asian or Black Afro-Caribbean communities, and it was very challenging. Almost and all the response we got with COPD happened to be white, and strangely in this example, men as well. And we found that in this audience, the importance of pharmacists and respiratory nurses was really important, because they were a trusted source, and because they weren't necessarily getting their advice from online sources. So we tried to map from this what people's user journey was. I won't talk to it on this, but basically look at the online and offline channels. The online were mainly our own channels. The offline channels, though, we're actually mapping how people got their information from different clinicians, support groups, ours or other people's, pharmacists, places of worship in some cases. The role of the media in terms of us putting press tools out there about good respiratory care. And seeing how we use that as a way of funneling people into our new health advice pages we're seeking to build. And then from that page we started to think about what should we be building. So thinking about those different audiences, we started to think about how we would have storyteller videos for everyone, basic health advice for everyone, but then specific advice targeted at people who are more interested in environmental issues. Animations for people who are less engaged, and actually looking about specific switching advice for a more engaged audience. So as part of this, our major consideration across all 3 categories was to make sure that the inhaler users' health was the priority over all other aspects, and accepting that there will be people who would be unable to switch to a different inhaler. We'd hope there'd be a minority of people, but we did accept that would be the case. And it challenged us because we realized because we found that the participants were far more likely to actually recognize inhalers by brand name rather than type. And as an organization and staff, we spent a lot of time trying to not engage in brand names and deliberately not know what certain companies' products were, because we work with all companies. This was quite challenging for us to think about. And we also accepted that the changing inhalers might be upsetting for some people. So again, we need to make sure we manage this successfully. And crucially, we need to be thinking about emissions. About this being inhaler emissions, not individuals, and not trying to portion blame to individuals. And I'll come back to that point towards the end. So just quickly on specific messaging. So look at the environmental group. The messaging we're looking at here is that we need to focus on the environmental impact on inhalers. This group was particularly conscious of the plastic waste issues and disposal of inhalers, and wanted to focus on the impact, the environmental impact of poor inhaler techniques. So we built the messaging. So our messaging for this group is here as follows. So we want the audience to take simple steps to know they are playing an active role in helping to reduce carbon emissions, because this is a group of people that actually want to be seen that they are doing their bit to improve the environment. But then our more disengaged audience, we need to start from the basis that the understanding of digitized inhalers was relatively low. That actually out of all the actions we're looking to get them to think about, the only one they're probably most likely to have done is disposing of inhaler back to a pharmacist. We need to focus on the health-related benefits to them, crucially, and how they would improve. We needed to think in the background about environmental arguments, but recognise that this is going to be a side argument, a secondary concern for this audience. And to be conscious that the healthcare professional relationship is really, really important. So the messaging here for these people is focused around making them feel better, and actually they deserve more out of their respiratory care. So the message is that by taking simple steps to manage your condition, their condition, you could save money and time, and crucially feel better as well. That's our simple messaging there. And then finally, on the engaged audience, which is probably the majority of people in many ways, it's the biggest group of people. We need to be mindful of managing their stress and anxiety around changing inhalers. We need to be conscious of inhaler techniques and making sure they use them in the right way. We need to make sure that they can manage good asthma and good COPD care, managing venting symptoms in the first place. And we need to think about making arguments around DPIs being simpler to use, because we need to think about spaces to try and make the messaging as simple as possible. And the worst possible thing we could get from this audience is actually discouraging them from taking their inhalers because they're worried about the environment. So we need to be very careful with our messaging here, that actually the worst thing we could possibly have is someone to start reducing their use of inhalers because they want to be seen as not being part of the problem, and therefore taking this a lot and then take them less. That's a real worry for us, because obviously the environmental impact of an A&E admission is far, far worse. So the messaging here is around taking simple steps they can improve their symptoms and ensure they're managing their condition in the best way. I'm conscious of time, so I'll just skip over this, but this is just a top line summary of the messages. So the environmentalist is around changing inhalers if you can. Disengaged people, it's around using preventer in inhalers. And an engaged audience, we're looking at improving technique. So in summary, what we know about people living with asthma certainly is the majority of people are happy with the principle of switching to DPIs to improve the environment. And we know there is strong support with the COPD audience as well, just not as much support, certainly more concern, more reticence there. We've learned we need to target messages to different audiences, and our hope is to use this approach and the collateral we're creating from this to our advantage here in Wales, as well as in Scotland and Northern Ireland. And we need to focus on the benefits to patients as well as the benefits to the planet. We've got some really challenging tasks ahead of us, and if we are going to move to a situation where as early as 3 years' time in 2025, we're going to have 80% of people having lower global warming products, this is going to be really, really hard. But with the right behavioural change campaigns, working with patients as well as working with healthcare professionals, we can at least get close to achieving that, if not hopefully achieving that. Thank you for listening.